So, good morning to all. So, we are going to cover the lectures on learning theories, and this will be the first lecture. We will have 4 lectures on learning, and the first one we are starting with behavioral learning theories. In introduction, a person's response that are not inherent to its biological makeup are classified as acquired or learned behavior. The traits which is not directly linked to the genetic factors and biological factors that you acquire from learning through your experience in and other means is called as learned behavior. Learning can be characterized as a process through which an individual undergoes modification, often enduring. Enduring means long lasting, based on interaction with the surrounding environment, personal actions, and observations. So we used to learn from various factors which are there around us, like environment, personal actions, and observations. We first learn to respond simply to immediate thing around us in the initial phase of life, like pulling away from painful experiences before they happen. So, in early childhood, we develop many motor skills such as reaching for and holding objects and standing without help. We also start to learn how to speak. As we gain these motor and verbal skills, we improve our problem solving abilities also. We learn about ourselves and our surroundings. This shows a gradual shift from basic learning to more complex learning. We are also discovering how to learn effectively. Different types of learning happen at the same time and are closely connected and dependent on each other. So various theories of learning, one theory is not always acting upon, various theories of learning acting simultaneously and are dependent on each other. So further, we will get to learn about the connectionist theory, classical conditioning theory, and Skinner operants conditioning in the brief. And we will learn how these learning principles shapes the human behavior, maybe positive or negative. Starting with the connectionism was given by the Edward L. Thorndike, and he was a psychologist in US known for his learning theory called connectionism. He focused on education basically and particularly on learning, transfer, individual differences, and intelligence. He used experimental methods to assess the students' achievement results. His influence on education is recognized through Thorndike Award, which is given by the American Psychological Association for Teachers. He suggested that basic kind of learning is about creating links between what we sense, means how we perceive the things, and how our brains act on that response. He thought that learning usually happens through trying different things and figuring out what works. So one of his theories, trial and error learning. In a typical experimental situation, a cat is placed in a cage by him. The cat can open an escape hatch by pushing a stick or pulling a chain. So cat was placed in the box and there was a chain and there was a push button by pressing or pulling of which the cat could escape. So after a series of random responses, the cat eventually escapes by making a response that opens the box. The cat then is put back into the cage. Over trials, the cat reaches the goal quicker and makes fewer errors prior responding correctly. Learning through trial and error happens slowly as we keep what works and let go of what doesn't. So, if you try for some experiment or some kind of learning in your life, if you do experiments, then out of 10, maybe one will successful, and out of 10 experiments, you will find one experiment will give you the results. So in connection with the psychiatry and clinical psychology, this is happens in substance use disorder also. And one should know that the basically initial consumption of substance is not very much enjoyable. It is felt like discouraging, and after repeated attempts, that substance can can give that effect which is considered as pleasurable to the individual. He also gives the law of effect. The law of effect is when a response leads to a positive outcome in a specific situation, it is more likely to happen again. If the result is positive, then one will do the behavior again. On the other hand, if response is results in negative outcome, it is less likely to be repeated in that same situation. So it is it can be correlated again with the substance use disorder. So many persons tries it, but not always all the persons are get dependent on it. So this law of effect has main two ideas. The law of use states that responding to a stimulus make the connection stronger, and law of disuse says that if there is no response to the stimulus, the connection becomes weaker and may be forgotten. So positive feelings such as reward and praise by someone else make stimulus response links together, and negative feelings make them weaker. The other principles of Edward Thorndike was law of readiness, which states that when one is prepared or ready to act, to do so is rewarding and not to do so is punishing. So the act is rewarding or punishing, one has to uh, taken in account and to become ready to act further in the future. When one is prepared to learn a specific skill, like facing say, social situations like uh, coming onto the stage, performing something on the stage, or other social situation in which one like to face, based on their development of previous knowledge, they have previous knowledges, knowledge action that supports this learning will be beneficial. However, if one is not ready or lack the necessary skills like knowledge, oration skills, or communication skills to face the social situation, they may try to they trying to learn can be frustrating and unproductive for them. The principle of associative shifting. The concept of associative shifting describes how reactions to one stimulus can eventually transfer to a different stimulus when there is a slight change in the original stimulus over time. For example, to help intellectually disabled person how to learn how to wear a trouser, first start by teaching them to hold it in the right way in the orientation of left and right, then slowly demonstrating the further steps like putting leg into the leg one by one, the chaining, buttoning, and wearing belt in the last. Further, in other principles, the principle of identical elements that affects transfer is generalization. Training in a specific skill does not necessarily make someone better at the skill overall. For example, wearing trouser won't help to learn how to wear a shirt. To help learn, skill should be taught using various type of educational materials. So his work was basically in the education. So he gave the principles of teaching, and he gave form habits. Do not expect them to create themselves. Beware of forming a habit which must be broken later. Do not form two or more habits. One will do as well. So one type of problem solving skill may fit to the one student. Other thing being equal, have a habit form in a way in a which is to be used. Now coming to the classical conditioning you may have know it was given by the Ivan Pavlov, and it involves forming an association between events in the environment and our behavior. For example, our stopping at a site of a red traffic signal is an example of conditioned response. There are terms which classical conditioning covers is unconditioned stimulus, unconditioned response, conditioned stimulus, and conditioned response. The unconditioned stimulus is the stimulus that unconditionally, naturally, and automatically triggers an unlearned response. We will discuss in the further slides by means of the picture. Unconditioned response is naturally usually unvarying response evoked by a stimulus in the absence of learning. So unconditioned response is triggered by the unconditioned stimulus. There is a conditioned stimulus, a previously neutral stimulus that after repeated association with that unconditioned stimulus elicits the same response affected by the unconditioned stimulus itself. And the response which is unconditioned is a new or modified response elicited by a stimulus after conditioning. So we will learn what is this stimulus and responses. So you can see the picture in the left side, but you may not be able to visualize. I will explain the picture. There is a dog and the food. When the food is presented to the dog, this food is considered as unconditioned stimulus, which is natural and which gives the response of salivation in the dog. So this salivation, because of the food, presentation of food is unconditioned response. Further, what happened is a whistle was blown and it was seen that whether salivation occur or not, there was no salivation. In the third step, the food and the whistle was applied together simultaneously and there was salivation. And after repeated attempts of this third step, when food was removed from the stimulus, even the dog started salivating because of the conditioning of this whistle with the food. So this is classical conditioning. So further, there is a term is extinction. Repeated non-reinforced presentation of the conditioned stimulus means repeatedly presenting the whistle only for further period of time will keep the response in extinction phase. The another term is spontaneous recovery. It happens after a period when conditioned stimulus, that is whistle only, is not shown, leading to a presumed extinction of conditioned response, which is salivation with only whistle. If the conditioned stimulus whistle only is presented again and again and the conditioned response reappears, we say that this conditioned response has a spontaneous recovery from extinction. This happens after the extinction occurs. Again, the experiment is done with conditioned stimulus. The spontaneous recovery of salivation occurs thereafter. So this is the same figure. Now you can see clearly there is food and response of salivation. There is a whistle and there is no salivation. Whistle is added with food. The response is salivation, and after repeated experiment, only whistle was blown, and one can see the salivation as response. There is a term generalization refers to idea that conditioned response salivation with only whistle happens with stimuli that are similar to the conditioned stimulus whistle only. If you give the similar type of stimulus like whistle, one can give metronome or clicking clocks or timers which have similar kind of sound can produce the same response of salivation. This means this is generalization of conditioned stimulus. So the dog can have salivation with clocks also, with timers also, and with metronomes also. Now discrimination. Discrimination is opposite of generalization, where the person is able to discriminate between the various kind of stimuli. To tease this, researchers might connect the specific stimulus with unconditioned stimulus while showing other similar stimuli without the unconditioned stimulus. Now the metronome will be produced with the food and other stimulus will not be produced with the food. So the person or at this time the dog can differentiate between the type of stimulus. There is higher order conditioning also. In higher order conditioning, one can see the explanation in the picture. There is a electric can opener. This is conditioned stimulus applied with food. In this experiment, in the next step, the electric can opener was added with the second order stimulus and salivation occur because of this can opener. Now in third step, the can opener and food were not produced and the only this cabinet door sound was produced, and this also caused the conditioned response, which is salivation in the cat. This is second order. The first order was the can opener. The second one is the squeaky cabinet door. This is the another example of emotional reaction because of the conditioning. What happened in this experiment? Albert was an 11-month-old infant who showed no fear of the white rat. There was no fear because of the white rat. And during conditioning, a hammer was stuck against a steel bar behind the Albert as he reached out for the rat. And 1 week later, when the rat was presented, Albert began to reach out, but then withdrew his hand to grab the rat. Tests over the next few days showed that Albert reacted emotionally to the rat's presence, and there was also generalization of fear to the rabbit, dog, and fur coat. This is the another example of emotional reaction conditioning. A learning chain can start with a dentist drill. This drill causes fear of dental chair for someone, which then creates anxiety about the magazines in the waiting room. So magazines were conditioned with the fear of drilling. Later, this anxiety can make someone uncomfortable when they see a similar magazine at a friend's home, where no such drilling machine were there, and the person become afraid or fearful because of that similar magazine. These are the examples from the clinical psychology or psychiatric perspective. Fear responds to specific stimuli. You must know that there are disorders which are called as specific phobia. The phobia to a specific subject like spiders or height or something like that. In this example, if you have had a traumatic experience involving loud noise, yeah, there was an experience and that experience associated with loud noises. So your brain might have formed an association between the sudden loud sounds and the impending danger. This is why some people with PTSD means post-traumatic stress disorder, can have intense reactions to seemingly harmless stimuli, like other kind of loud sound can produce the fear response or response of anxiety. Emotional reactions to place, sight, sound, and odor. One can relate the substance use disorder and anxiety disorder. In substance use disorder, when a person who is fond of, for example, drinking alcohol, he will get emotional reactions when we pass by through that road on which the liquor shop is there. Sight of some object which is associated with drinking pattern, like uh, drinking on some specific kind of table, or that table has some kind of object on it. If the person sees that object in future time, then he will get conditioned to that object and may get a response of craving. Similarly, some kind of sound and odor can produce that response. This also happens in taste aversion and food preferences. For example, if one had got food poisoning because of the seafood, the classical conditioning can create strong aversions to the other foods associated with the illness. For example, he had taken the seafood and along with that he also had had salad or some other food which are not seafood, and that person can get aversion to these other foods also. And this happens in a vice versa form also. And on the flip side, positive association can make certain food irresistible. If the experiences are good, then certain food can uh, make you more hungrier. The clinical applications of classical conditioning, the aversion therapy of addiction treatment. Aversive conditioning in psychology or psychiatry pairs an undesirable behavior like drinking alcohol with an unpleasant stimulus, for example, a nausea inducing drug which is known as disulfiram. When this disulfiram is given and the person consumes alcohol, he gets the nauseatic feeling and vomiting. So the goal is to create a negative association with the addictive substance or behavior by the means of this aversion therapy. Another is systemic desensitization. In systematic desensitization, there are few steps which are taken to eliminate the anxiety provoking conditioning. For example, in the first step, the therapist and the patient work together to create a list of situations that cause anxiety and rank from least to most stressful for the patient. A person can have anxiety or fear of many things, many situations. So these situations and objects are ranked from least to most. In the second phase, the patient practices relaxation by visualizing enjoyable places like being on a beach or using a cue word such as relax to decondition or to become desensitized from that fear. In the third phase, while feeling relaxed, the client pictures the least anxious scene from their list. This process can be done multiple times before moving on to the next scene or next fearing object. So there are multiple steps can be taken. For example, in uh, case of fearing from spider, so one can ask them to think about the spider first, and then further then when the anxiety is reduced because of thinking, then person can be given a photo of a spider. In further step, real spider in a closed box is exposed. The fearing person now can hold the box with the spider. Spider crawl on the desk openly. The spider crawl on the shoe. The spider crawl on your uh, trouser, and spider crawl on your sleeve and on your bare arm. So this kind of exposure is given to desensitize the person from fearing spider or any other object or situation. Desensitization can also be done by counter conditioning. So when you think of a calming scene, you feel relaxed. Anxiety triggers are linked with these calming scenes. So relaxation cannot happen with anxiety. By starting with mild anxiety trigger and pairing it with relaxation and then gradually move up to stronger triggers, all anxiety triggers should eventually lead to relaxation. So conditioning is done with the relaxing memories, relaxing movements, or the relaxing pictures in the mind of that person. Now come to the operant conditioning. Operant conditioning is given by B.F. Skinner. He wrote a book, The Behavior of Organisms, which was published in 1938. He had used operant conditioning ideas in areas like school learning, discipline, child development, language learning, social behavior, mental health, medical issues, substance abuse, and job training. So these were the areas where operant conditioning was considered to be applied. So there are two kind of conditioning. One is type S, which we have already known, the classical conditioning given by the Ivan Pavlov. The second one is type R, which is given by B.F. Skinner, known as operant conditioning. And this operant conditioning is, you can say, is learning by doing, learning by your own experiences. In that case, the dog didn't experience himself with that, with those stimuli of food and whistle, a whistle along with food. But here the person himself is the active participant. So there are basic processes of operant conditioning. We will discuss one by one. One is reinforcement. A reinforcer is any stimulus or event following a response that leads to response strengthening. Reinforcer comes into picture when something has done or something has happened. After that behavior, what happens? If you have done good in your examination, there is a praise by the parents. And the praise comes after you got good marks in your examination, and that praise is considered as the reinforcer. Reinforcers are defined by their effects. They cannot be determined in advance, because which reinforcer will work cannot be determined beforehand. When the behavior is strengthened after that reinforcer, so one can say that this is the reinforcer for this kind of behavior. Reinforcers depend on the situation. The basic operant model of conditioning is the three-term contingency. One is discriminative stimulus sets the occasion for a response, which is R, to be emitted, which is followed by reinforcing stimulus, which is SR, or reinforcement. So this follows the model of ABC. Uh, the A is antecedent, B is behavior, and C is consequence. Yeah. Something antecedent before the behavior has happened, and because of that the behavior is expressed, and because of expression of this behavior there is a consequence which may be uh, which may be reward or reinforcer. So there are three types of reinforcement. One is positive, one is negative, and third one is punishment. Positive reinforcement means giving something nice. You know, something is added as a reinforcer, giving praise, giving uh, uh, prize, giving uh, like grades, giving degree, giving chocolates, giving favorite foods, maybe the positive reinforcement. Negative reinforcement means taking something away from the person for a particular response, which means uh, if someone has done some kind of behavior, in lieu of that behavior one cannot watch TV in the evening time. So watching TV in the evening time is removed. This is a negative reinforcement. Although there is a removal, but that removal is may become reinforcer to modify his behavior. That person will try to do the things which is wanted to avoid that removal of the TV watching. So this is a reinforcement. Negative means something is removed, positive means something is added. The third term is punishment. The punishment reduces the chances of a person reacting to a stimuli in the future. It can include taking away a positive reward or adding an unpleasant consequence after a response. So this can be considered as punishment also. In this table, we will learn what are positive reinforcer, what are negative reinforcer, and what is punishment in terms of present the negative reinforcer and removing the positive reinforcers. For example, teacher gives a independent study time to a student L, and L studies in that time. So teacher praises L for good work. This is a positive reinforcement. Something is given. In another example, teacher gives independent study time. Again, the student studies. Teacher says L does not have to do homework. So this is removing the negative reinforcer. The reinforcer is removed and that is negative, which means the child has not to do the homework. To sustain this not to do the homework, the child may uh, do the wanted behavior more frequently. The third example is teacher gives independent study time and student wastes the time and teacher gives the homework. So presenting negative reinforcement, negative reinforcement. In the last, teacher gives the independent study time. Again, the L wasted the time. Teacher says L will miss free time. In the third example, something was given. In the fourth one is something is removed. Okay. Extinction also works in operant conditioning. Extinction happens when a behavior weakens because it is not rewarded. For example, students who often raise their hand but are never called on to answer something may eventually stop doing so. Similarly, people who frequently email someone without getting a response might give up on emailing that person or phone call. The speed of extinction depends on how often the behavior was previously rewarded. If there were only few rewards, extinction happens quickly. If there were many rewards over time, the behavior lasts longer. And this rewarding system also can be correlated with the mobile games. If you are keen to play mobile games, there are certain kind of rewards which are given to pass on the stage. So you have to earn something like coins or some gadget or some weapon or something else to surpass the previous level of games. These rewards are given on daily basis also, weekly basis also, quarterly basis also. So you keep on engaging with that mobile game to waste your time. You know. In the basic processes, there are primary and secondary reinforcers also play into the picture. Primary reinforcers are like things like food, water, and shelter, which are essential for survival. These are the basic requirement of a human being. Secondary reinforcers are linked to primary reinforcers through conditioning. For example, a child's favorite glass for milk becomes a secondary reinforcer because it is associated with milk, a primary reinforcer. Primary reinforcer is milk and that favorite glass. है ना, मैं तो इसी गिलास में पीऊंगा, किसी दूसरे गिलास में दिया तो नहीं पीऊंगा. So this becomes the secondary reinforcer. A generalized reinforcer is a secondary reinforcer that connects with the multiple primary reinforcers. है ना? In the secondary reinforcer, there is only one thing which was connected is milk. Now in the generalized, it is connected with the, for example, a person often works long hours to earn money, which is a generalized reinforcer. In lieu of this money, one can purchase various reinforcers like food, house, TV, vacations. So generalized reinforcer is working long hours. Operant conditioning helps explain how social behavior develop and persists with generalized reinforcers. Children may act in a way to get adult attention, which is reinforcing because it is linked to a primary reinforcers like food, water, and safety. In terms of education, important generalized reinforcers include praise from the teacher, high grades, privileges, honors, degrees, distinctions. These are often connected to other generalized reinforcers such as approval from parents and friends. Money as a college degree can lead to a good job. Now comes the Premack principle. What is Premack principle? Premack principle is to rank the reinforcers. For example, to apply the Premack principle, a teacher might say to a child, after you uh, finish reading this book, you can go to a media center or to a library. You can have more library points. You can go to an art gallery or you can go to a computer lab. So these are the number written on these pictures are 6, 1, 2, 3, and the total is 10. After 10 such events of reading book, the child goes to the media center 6 times. So by this method, one can figure out which is the strongest reinforcer for that particular person. Now punishment. Punishment reduces the chance of reacting to a stimulus in future. As we have seen the example of two example of punishment, one was positive and negative, but the punishment reduces the chance of reacting to a stimuli in the future. It can include taking away a positive reward or adding, we all know. Punishment doesn't completely remove it. Once the threat of punishment is gone, the behavior might come back. Until there is a threat of punishment. For example, a child may figure out or may become neutral to the punishing behavior. The child may become more aggressive towards the parents, or if the punishment, the threat of punishment is gone completely, the child in younger age may found smoking in front of their parents. So common punishments including losing privilege, being taken out of the classroom, suspensions and expulsions. However, there are many alternative to this punishment. What can be the alternative? One can change the trigger. If the separate the misbehaving student from other who are also misbehaving. So two students can be separated. So trigger to both of them is somewhat diluted. Let the behavior persist. Allow the student who is standing when they should be sitting to keep standing. This is the Guthrie's fatigue method. Eliminate the unwanted behavior. Disregard minor misbehavior so it doesn't get attention from the teacher. Do not give attention to the minor misbehavior. Encourage a different behavior which supports the positive learning. You know, a wanted behavior can be encouraged, so this wanted behavior will increase in frequency and the unwanted behavior should be ignored so that get reduced in frequency. There is generalization in operant conditioning, and in context of clinical psychology, there is a group known as Alcoholic Anonymous. The Alcoholic Anonymous group is the group of people who were in the past were dependent on the substance. Alcoholic Anonymous for the person who were dependent on alcohol. है ना? By virtue of this Alcoholic Anonymous, and this is basically the principle of generalization in operant conditioning, which suggests involve others in program that promote behavior change. So these past drinker can become a role model, can be uh, deeply connected with the person who are dependent currently. So they can understand their problem together. Let person know that they can achieve high performance by seeing these persons. Teaching person to assess and track their own behavior. Remove artificial rewards like points and use neutral rewards like privileges Encourage person to help decide which behavior to reward and how to reward them. Help person see how changing their behavior can lead to benefits by connecting changes in their interest. Provide reinforcement for person in various environment to help them understand the difference between rewarded and non-rewarded situation. Train regularly to continue supporting the behavior development of person who transition from special classes. So the principle of generalization is used in anonymous groups. Again, the discrimination is opposite of generalization in operant conditioning. It means reacting in different ways, either stronger or weaker, based on the specific stimulus or characteristic of a situation. To teach discrimination, we should reward the desired response and ignore the unwanted responses. Studies on motivation reveals that students who adaptively manage their mistakes are more likely to continue work on tougher tasks compared to those who have learned without making an error. So failure is the pillar of success, some used to say. Now let us explore how operant conditioning leads to change in behavior, as this has significant effect on learning. The method focuses on rewarding behavior that gradually get closer to target behavior. To shape behavior, one should follow the sequence. The sequence is, the first is find out what the patient can do right now. Define the behavior you want the patient to achieve. Look for rewards in the patient's surrounding. Divide the desired behavior into small steps to learn one at a time. Help the patient progress from their current behavior to the desired one by rewarding each small step they take towards it. So this basically has role in personality disorders, stressful, the disorder of stressful situations, and can also be implied in psychotic cases also who are having negative symptoms like in schizophrenia. So this behavior modification has been used with both adults and children in various places like school, therapy sessions, jails, psychiatric setups. So behavior modification is not only for the children and younger population. This can be implied on the parents also for effective parenting. Punishment is not commonly used in the behavior modification, and when it is, it usually means taking away something positive instead of adding something negative. Behavior modifiers usually consider three main points: which behavior are harmful and which one should be encouraged or reduced, what environmental factors currently support this behavior, either by keeping bad behaviors going or making it less likely to show better ones. Okay. What changes in environment can help alter the person's behavior. So these are the questions should kept in mind to apply the behavioral modification. So this model, which is known as cognitive behavior modification, there are various type of therapies like cognitive therapies, behavior therapies, and a combined therapy is known as cognitive behavior therapies. So thought of one person cannot be ignored, and these thought can lead to the feeling of anxiety or feeling of other kind of negative emotional reactions, and this reaction may lead to a behavior which is maladaptive. This is a cycle of thought, feeling and behavior which is considered in cognitive behavior therapy for certain kind of psychiatric illnesses. In summary, we have learned that behaviorism, particularly through conditioning theories, was the leading approach in learning psychology. These theories focuses on how learning occurs due to environmental factors without need to consider mental process to understand how behaviors are acquired, maintained and generalized. Key figures in this field include Thorndike, Pavlov, Guthrie and B.F. Skinner. Thorndike proposed that response to stimuli become stronger when they are followed by rewarding outcome, while Pavlov showed through experiments that response could be conditioned by pairing different stimuli together. Guthrie suggests that close relationship between a stimulus and a response leads to their connection, and B.F. Skinner in operant conditioning shows that the participant is the active one to act upon, which is based on the idea that environmental features acts as a signal for behavior. Thank you.